And let's go live to KPIX5's Wilson Walker, who reports a third wave of cases may not crash quite as hard into Bay Area hospitals. Wilson?
Liz, think back to March and the first wave of coronavirus cases that had everyone worrying about capacity, just having enough hospital beds. Well, here we are on what you might call the third wave, and doctors are much more confident.
We are starting to see a little bit of an uptick in our county and a little bit in our hospital.
Stanford University Dr. Sam Shin says San Mateo County is like much of the Bay Area. Cases are up, but not as much as the rest of the state. And he also says doctors have come a long way since the first wave.
Yeah, no, certainly. I mean, having the benefit of the experience over the last many months allows us to be better prepared and know how to care for our patients.
Yes, I mean, I think that we've learned a lot from the early days in late February, early March to now. There have been advances not only in types of drugs that we have available and methodologies, but in the sequencing of drugs.
UCSF Dr. Peter Chin Hong credits new treatments with keeping more people out of intensive care and a better understanding of the virus itself for shortening those less severe hospital stays.
We've learned some more science about how long people are infectious for, when they can go home. That's cut down on hospitalization rates.
So this new wave of cases may not stress our hospitals like it might have previously.
I like that, we've had a lot of experience preparing, not just for the first, but by the second, and we continue to be vigilant and be, in my opinion, well prepared for a potential third wave.
But no matter how prepared, there are limits to what any one hospital can do.
We do have weapons to fight disease when it does occur, but even the best weapons fall flat when you have 1 million people coming in and wanting to use the hospital facilities.
So what are they worried about? Well, you just heard it. They're worried about how many people contract the virus if we are on the beginning of a significant surge, but they're not so much worried about capacity. They are kind of worried about other things, though. The availability of the drugs you just heard about, the things that are making treatments better and more effective. Now those become part of the equation, less so the number of hospital beds, more all of the other things that are required to take care of patients altogether. We're live here on the Stanford campus. Wilson Walker, KPIX5.